The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome to Health Matters. I'm your host, Dr. Lana Marconi. Tonight we're going to look at alternative methods for pain relief. I have an acupuncturist, 2 chiropractors, and a massage therapist all lined up for tonight's conversation. Please feel free to call in with any relevant questions you have for my panel. The number is 905-595-LIVE. With me in studio right now is acupuncturist Stephanie Chong. Hi, Stephanie.
Hi, Dr. Lana.
Thank you for being here.
Thank you very much.
So, Stephanie, how long have you been practicing acupuncture?
I've been practicing for 3 years now.
Wow. Oh, and I see that you brought some tools of your trade. What do we have here?
I'm going to do a demonstration for acupuncture.
Okay.
If you'd like to give me your arm.
Okay.
Okay.
Sure.
So we're going to do 3 points on your arm. Okay. One on your hand, one on your wrist, and one on your elbow. Mm-hmm. Okay. So first, let me clean the area because it will penetrate the skin.
Okay.
So it does need to be sterilized. Okay. So just points there. And the first point we're going to do is called large intestine 4.
Okay.
Now each of these points also have a name, but for simplicity's sake, we're just going to use the numbers. Okay. So you might feel a slight prick or a slight sting.
Sensation from the needle?
Yep. So this point is a great point for expelling exterior symptoms. So for example, if you feel a cold coming on, you might feel fever, chills, sore throat. This is a great point to treat the acute stages or the early stages.
And this is the large intestine channel, and it runs to the head, doesn't it?
Yes.
Does not?
So it goes up the arm, up the shoulder, up the neck, and it ends on the face near the nose.
So is it also good then for like frontal lobe headaches?
Yes, frontal lobe headaches, and also anything to do with the eyes, the ears, the nose, and the mouth. Okay. So like nasal congestion, toothache.
So this is great for cold season?
Yes, it's a great point. It's also great for calming the mind too. If you maybe get anxiety or agitated easily, this is a great point for that.
Well, normally when I get acupuncture done, I mean, I'm lying down on a table, and for me, it induces the relaxation response, and I fall asleep. So I'm hoping I don't fall asleep right now, because it's not good if the host falls asleep.
Well, stimulate the needles a bit.
But if I do, here's a note, so the show's all yours.
Okay.
Okay, so what's this point?
So the next point is called triple warmer 5, or Sanjiao, or triple burner. Yep. Again, like large intestine 4, this helps expel the exterior. And it's also great for any channel pain or meridian pain. So again, this goes up the arm, up to the back of the shoulder, and ends around the ear. Okay. So it's also great for any ear problems, like ear infections, earaches, and that sort of thing.
I'm feeling a lot of sensation around this large intestine 4 area. Like it's really intense, like almost like eating a jalapeno pepper. That's how intense it is.
You might feel, the heaviness or a dull, aching sensation, right? Yeah, that's a good
lot
sensation.
of energy moving, and I am feeling some energy trickling up this way.
Yes, you might feel like kind of like a tingling or even that electric sensation. Okay, so if you'd like to relax your arm a bit. Sure. So this last point is called large intestine 11. So this one does connect to the one on the hand because it's on the same channel.
Okay, so it's on the same channel as this one.
Yes, same channel, so it goes up like this. Okay. And so this one's also great for expelling heat, more particularly.
What's heat?
Heat, so like it manifests in symptoms such as fever, extreme thirst, maybe even inflammation. So this would help draw out some of that heat from the body. Okay. Okay.
So pain, right?
Pain, pain for the elbow, pain on the shoulder. This is tennis elbow. Yes, this is a great point for that. And it's actually really a good point for cooling the blood. So that
what does that mean? Because I know in Chinese medicine, I mean, you guys have your own terminology in terms of things being dry, or there's wind or heat or cold.
Yes. So heat in the blood is really heat in the blood level, we say. And so that would manifest in a lot of skin conditions. So like psoriasis or eczema, we can say it is heat in the blood because you get the redness, the itchiness, the swelling sometimes, dry skin.
Wow, it's just really coming up to my neck. I love it. I love it.
So what we can do is actually stimulate this. Yeah. Okay. So like you said, you mentioned the sensation here. Okay, we call that the de qi sensation. It's a heaviness. De qi. Yeah, it's a heaviness or a numbness, achy sensation, and that's a good sensation. We want to obtain that with every needle. And once we've obtained that, we can actually manipulate the qi.
Yeah, like there's certain things that you can do with the needles. Like there's definitely, I mean, a host of needling techniques, right? Like if I flick it, what does that do?
So that might help disperse the qi a bit.
Okay.
From that area.
Like disperse the stagnated qi, and
Yes.
and maybe like promote the arrival of vital qi.
Yes.
Like it's a two-in-one?
You can say it like that.
Yeah.
It also helps spread the qi from that area.
Okay.
So for example, let's say we've put this needle in, but we want the needle to go up, or the qi to go up. So we can twirl, that's one of our techniques, like so. We can do the flicking.
So you're driving the energy.
Yes.
Right.
And then what we can also do is tap, like that. And you'll feel eventually, because the qi come here, when you're tapping, it starts to go up the channel. And that's how we can direct the qi or manipulate the qi.
Interesting. So how many, there's what, 12 primary meridians that are associated with the organs?
Yes, there's 12
Do you want to talk about those? And we're going to post up an acupuncture model so people can actually see the intricate design of the meridian anatomy. And you're going to talk about the meridian lines. I mean, how many do I have in my hand?
So on the arms, there's actually 6.
Okay.
So right now we already had the large intestine, the sanjiao, and on here we have the small intestine. And on the other side of the arm, we have the lung, the pericardium, and the heart meridians. Okay. Okay, on the leg, we also have 6. So on the inside of the leg, we have the liver, the kidney, and the spleen meridians. And on the outside of the leg, we have the stomach, gallbladder, and urinary bladder meridians.
So the points are a way to access the meridians, and the meridians access the internal organs.
Yes.
Right? So acupuncture is about balancing the meridians, so you're balancing also your internal organs.
Balancing the energies of the
energies
organs.
of that. Now, you know, clearly when someone comes to see you, you're not going to needle them right away. You're going to probably do, I would imagine, like an intake process.
Yes,
okay,
that's right.
So describe to me what that procedure looks like in Chinese medicine.
Okay, so our diagnostic methods begin first with observation. Okay. So the minute the person walks into our office, we're already starting our diagnosis. So we're observing their body language, their posture, their demeanor, maybe any physical features that are significant. For example, do they have a red face that day? Do they have swelling on the neck? Maybe it's a young person with very thinning hair. Those are all indications to us of what can possibly be going on in that person's body. And so after that, we go through a comprehensive health history where we ask questions to get a better understanding of their lifestyle and dietary habits and also health habits in general. Okay, so we ask questions about sleep and appetite and bowel movements and even emotions, because all of that ties in with health. Sure. And so after that, we do the tongue and pulse.
Yeah, and that's what's popular in Chinese medicine,
yes,
the tongue. I'm not going to stick out my tongue, so don't ask me to. But describe why the tongue is important in diagnostics.
The tongue actually reflects the whole body in general. So we're looking at not only the organs, because the organs are reflected in different areas of the tongue. We're also looking at the coating of the tongue.
Like if it's white or greasy?
Yeah, sometimes you notice people have a thick coating on their tongue, and that can represent something we call dampness in the body, or phlegm in the body. And we also look at the shape of the tongue. So is it a big swollen tongue? Is it a thin, small tongue? And we also look at the moisture level. Is it a very dry tongue? Is it a very wet tongue? And each of those represents something different in Chinese medicine.
Okay. What about teeth marks?
Yep, teeth marks too.
Okay. So you look at the tongue, and then what about pulse? You guys do it differently than Western medicine.
Yes.
Okay.
So the pulse.
So show me what you do for pulse.
Okay. So the pulse,
that out of the way.
like the tongue, also represents different organs.
Okay.
So on the right side, and we take the pulse on the thumb side of the wrist. Okay. On the right side here, we have the lung, the spleen, and the kidneys. Yeah. And on the left side here, we have the heart, the liver, and the kidneys.
So just by feeling those different areas on the pulse, you're able to get an idea of what the energy is or isn't like in that particular organ. Like if you're putting your hand on the kidney, you can get a sense of whether it's deficient in energy or has an excess of energy. Is that correct?
Because we're looking at the strength of the pulse as well as the shape and the quality of the pulse. So depending on if it's, for example, if it's a strong pulse, we say that that person's qi and blood is stronger. If it's a small, thin pulse that's very hard to feel, we say that that person's qi and blood is a little weaker.
Interesting. So from all that, it sounds to me like a very holistic approach to diagnosing a person. And obviously everyone's individual when they come and see you. And then from there, you determine really what your diagnosis is and then your treatment, where you're going to put the needles in. Now, how long do these needles stay in a person?
Typically, needles would stay in between 20 to 40 minutes, depending on the person and depending on the condition they've come before.
And you come in and out and twirl and flick and do all types of needling techniques.
Because we want to maintain that de qi sensation.
The de qi. The qi is, see, this one feels like it's hard to move because, and that means, if I'm correct, the qi is actually grabbing the needle right now. So correct. In people who are weak, it's very hard for the qi, or it takes a longer time for the qi to grab the needle. Like, see, this one's very erect.
Yes. And that's fine.
The qi's there. I can feel it there.
Right. And then if I'm even to pull it slightly, it won't move. And that's indicating that the qi has really grasped onto the needle and it's doing its work.
So in terms of pain, I mean, I love this approach because, one, it's drug-free.
Yes.
And it's really balancing your energy system. So this helps with what, knee pain, back pain?
Yep, it helps with all sorts of pains. But first we have to consider what is the root cause of the pain. So it can be caused from a deficiency, or it can be caused from an excess, such as an obstruction of the meridians. And so we first determine that before we can determine how to approach treating the pain. So for example, if it's...
Okay, yeah, no problem. So we're going to come to the end of the segment.
Okay.
So we got to take the needles out.
Okay.
I'd love to have them in longer.
We'll take them out.
But we'll take them out. And what about Chinese herbs in pain? How does that work?
Okay, herbs and food therapy actually play a big role in pain because it can help balance the energies of the bodies and provide nourishment to the body if that's the cause of the pain. So for example, if it's a kidney deficiency causing pain, we could add herbs to help boost the kidney energy strength, and now help support the lower back, for example, if that's the pain, and then we treat the pain that way.
Wow, you know what? It actually feels really relaxed. Just in that short period of time, it feels like very heavy.
Yes.
And now this one's off.
Yes.
So I'm gonna have to come to you to get needled afterwards.
Sure.
Just back to herbs for a minute. Ginger's popular.
Yes.
Yeah.
Ginger is actually a great Chinese herb. It helps warm the body because it's such a hot herb. So if you had yang deficiency, we say, manifesting in like cold limbs or cold sensations, we would recommend ginger to help bring warmth to the body and help circulate the qi to the extremities.
Okay, and you supervise a student clinic at the Ontario College of Traditional Chinese Medicine?
Yes, I supervise a student acupuncture clinic, and we have treatments there that you can come and get for $10. So that's a
wonderful. And do you have a phone number?
Yes. It's at 905-604-8855.
Stephanie, thank you so much.
Thank you so much, Dr. Lana,
for being here teaching us about acupuncture. And we're going to take a break. And when I come back, I have two very knowledgeable chiropractors. And I'm going to talk to them and learn about how they can help you with pain relief naturally. Stay tuned.
The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome back to Health Matters. If you're just joining us, we are exploring alternative methods to pain relief. With me now in studio are two lovely chiropractic ladies, Dr. Nancy Karenik and Dr. Kimberly McAnuel. And just for you home viewers, if you have any questions for my panel, please feel free to dial us here at 905-595-LIVE. Welcome, ladies, to Health Matters.
Thank you. Thank you for having us, Dr. Lana.
Oh, you're welcome. So what's the deal with chiropractic? How did it originate? There's got to be a story. What is it? I want to hear it.
Well, actually, chiropractic, well, the idea of working with the spine and looking at the spine to improve people's health and wellness originated back in the time of Hippocrates.
Oh, wow. That's
in
a
bone
long
setters.
time ago.
Yes, it's been around for a very long time.
Okay.
The founder of chiropractic was a man named D.D. Palmer. He was actually born here in Ontario, Canada, and then he moved to the States. While he was working in the States, he was introduced to a man named Harvey Lillard, who was a janitor, and he had suffered hearing loss. When you spoke to D.D. Palmer about this hearing loss, it was discovered that he used to work in cramped spaces. Yeah. When he was bent over, he heard a loud pop in his spine.
Ouch.
Shortly thereafter, he noticed a decrease in his hearing. So D.D. Palmer hypothesized that there was a connection between that pop and the decrease in hearing. He then felt Harvey Lillard's spine, noticed that one of the spinal segments was misaligned, did a manual adjustment to realign that. Shortly thereafter, Harvey Lillard's hearing improved.
And that's how it originated.
That's how it originated.
And he's from Canada.
Pickering, Ontario.
Yes. Wow, small world. And so I understand that D.D. Palmer had a son named BJ. Is that correct? Because I get the two mixed up sometimes.
Yes,
okay.
he did.
So BJ carried on his father's work, correct?
That's right.
Okay, so I have a quote here from BJ. I'm going to direct this to you, Dr. Nancy. So he said, actually it's on this sheet. B.J. Palmer, he said, living in us is an innate intelligence. If we could open those floodgates and let innate flow, we would be as good and as great as it itself. So when I pulled this quote from him, he was referring to the life force energy within us. So do you follow that motto in your practice? I mean, is chiropractic also about flicking on the switch to our life force energy?
Absolutely. B.J. Palmer was a true visionary, and he literally lived his life based on his innate and listening to that inner voice inside. So innate intelligence is the intelligence, and we're all born with it, and we need to kind of learn to trust that. To trust that, to live our life. And as chiropractors, that's the power of the body that we release in order to allow the body to self-heal and regulate.
Yeah. And that's like acupuncture. I had an acupuncture lady on just before you, and it's about stimulating the body's own innate ability to heal itself. So chiropractic is very deep. It goes above and beyond just manual adjustments, which I think a lot of people don't realize that, right?
The innate intelligence of the body animates our physical body, and it actually connects us to our universal intelligence.
Wow, that's big. Okay, so talk to me about your intake. What does that look like? If someone was to come see you, I mean, what do you do?
So when somebody comes in, we take a full detailed history of what it is that's brought them in, what's going on with their health and life in general, after which we do some scans. The scans that we do are completely non-invasive. They put nothing at all into your body, but take readings from your body. They give us a better picture of what's going on with your nervous system. Is there any stress that's interfering with the communication between your brain and the rest of the body? It also gives an idea of what's going on with the muscles. Are there areas where there's increased muscle tension, or are there areas where there's muscle fatigue? After which we do some hands-on orthopedic testing. We get in and we palpate or feel the spine, see how things are moving, and we take a look at a person's posture. If necessary, then we may also refer out for x-rays.
Okay. X-rays actually, the nervous system scans actually show us how the body is functioning and how much stress is on the nervous system, because your body can't function or heal, or innate intelligence can't flow if there's a lot of stress on the nervous system. So the x-rays, when we actually refer out for the x-rays actually show us how degenerative the spine is. Your spine degenerates kind of like your teeth decay, you know, so it gives us an inside picture of how long the person's problem has been there and how much damage has been done.
Okay, so my next question, and you somewhat touched upon it, is what is the system that you work with? And as you speak to that, we're going to post a photo of the chiropractic system that you work with, the spine, the nervous system. So do you want to just say a bit more about the spine and the nervous system and why that is so important?
Well,
like why I should care about my spine. Yeah. Why should I care about my spine?
Well, the mechanics behind it, we're taking a look as chiropractors at what's going on with your nervous system. Nervous system being the brain and the nerves that communicate with just about every single cell in your body and back again. That nervous system's housed inside your spine. So that's why we're taking a look at what's going on with your spine. Your spine.
Okay, so you have some spine. You brought some spines?
I brought some spines.
What spines are those?
Yes.
They are not real.
No.
Don't be
so this
afraid.
is an example of a segment of the spine. The spine is made up of 24 bones, each bone referred to as a vertebrae. In between the vertebrae are your discs. In order for you to have motion in the spine, it happens through the joints in the back there, and the yellow are the nerves coming out communicating with the body. Stress can cause those joints to go out of alignment. So when a joint's out of alignment and you put motion through it, it causes an irritation and inflammation. The body, being smart, says, I don't like that, and the muscles will tighten up around it to prevent that motion. If you have irritation, inflammation to the joints, and you've got muscles tightening up, you can cause compression, torsion of the nerve. That's going to interfere with that nerve's communication with your body. So our job as chiropractors, find that area where the joint's gone out of alignment, realign it, decrease the irritation, inflammation, relax the muscles, take the pressure off the nerves, and allow the nerves to communicate with the body, allowing the body to heal itself.
Absolutely. I mean, chiropractic is based on the premise that the body self-heals and self-regulates. As she just mentioned, the central nervous system controls the function and the healing ability of that. And when stress accumulates in our lives, be it physical, chemical, or emotional stress, it can overwhelm the body's ability to adapt to the stress, and therefore it subluxates. It's a big fancy doctor word. All it means is that that bone is not moving, pressing on the nerve, disturbing the life force or innate intelligence coming from the body to the brain. We as chiropractors are looking for those areas that are fixated or interfered with, those areas of interference, restore that connection between the brain and the body, so thereby the body can heal itself. So we're facilitators.
Yeah, and so what I'm somewhat hearing you say is that when it comes to pain, pain is like a symptom, it's not the cause, right? Is that correct?
That's correct.
And so Dee, going back to Dee Palmer, he said that there's a vast difference between treating the effects and adjusting the cause. Do you want to talk about that?
Yes.
What is he saying?
Well, Dee was, again, interested in how the human frame affects health, okay? So why two people sitting next to each other, why one gets sick and the other one doesn't. So pain, we really educate that pain is not the problem. Okay, pain is the body's way of expressing itself and telling us that there's something. I'm sorry.
No, I'm cutting off because we have a phone call.
Okay.
Hello.
Hello.
Hi.
Hi, how are you?
Good. Welcome to Health Matters. How can we help you?
Thank you for taking my call.
You're welcome.
This is a very interesting discussion you're having today. And I've been wanting to discuss this with my chiropractor colleague. The point I'd like to discuss is that neck manipulations cause stroke. What comment do you have in that regard?
The most recent research out there shows that the risk of stroke associated with a chiropractic adjustment is 1 in 1.5 to 1 in 5.85 million. So the risk is actually infinitesimally small.
So you have a higher risk of like going on an airplane in it?
Yes.
Yeah. Okay. Just to put things into perspective.
Yes. Yeah, it's an extremely small risk. And the most recent research, there was an article published in the European Spine Journal in 2008 where it was looking at the incidence of stroke of people in the emergency room and whether or not they had seen a chiropractor previously or they'd seen a general practitioner previously to coming into the emergency room. And the conclusion of that study was that there really was no difference in stats as to whether or not, if the person seen the chiropractor first, the general practitioner first, they had been coming in to emerge with the stroke already.
And it's all about perspective because, in Vitality magazine in this month, they talked about like just medication, for example, and now psychiatric medications are linked to chronic diseases. So there's such a high risk out there for medications if you really want to talk about risk.
Yeah.
Right? Did we answer your question?
In some ways, yes. But the statistics that were presented, I'll tell you this much. Having practiced as a neurologist for 10 years, not in this community but elsewhere, I've seen 3 cases of dissections of major blood vessels in the neck causing stroke. Now, fortunately, none of them died, but I think there was even a class action lawsuit in Alberta somewhere in which, there was death due to this. And I have no problems with chiropractors treating low back pain. I think it works, and, they're a major asset.
Yeah, and you know what, I'm just going to go back to the medications because medications are actually the 4th leading cause of death in Canada and in the United States. So, and that's a large, large number.
And also to speak on that, there's many different ways to adjust a person's spine, and we don't necessarily have to adjust a person's spine using a manual adjustment to the neck. So there's instrument adjusting, there's drop table work that, there's sustained pressure. So there's many different techniques. Over 120, if I'm not mistaken, probably more. And it's really an art.
Yep.
Sorry.
So thank you. We're going to have to let you go because we have another caller on the line. Thank you for your call. We have Kathy.
Hi, how are you?
Hi, Kathy.
Hi, I have a question. I have carpal tunnel syndrome in my right hand, and I was wondering if a chiropractor would help me alleviate some of the symptoms that I'm having.
Oh, you should have called in for the acupuncture.
Chiropractic can help too.
Yeah, definitely. Actually, one of the things that I like to do with my patients that have carpal tunnel syndrome is the use of kinesio taping. So I don't know if you watched the Olympics recently, but with the
Just FYI,
athletes,
you have a few seconds to answer this question.
okay,
Stay tuned, Kathy.
We're going to have to stay tuned.
We'll come back to kinesio taping and how it's going to help with carpal tunnel.
But absolutely, you can get your neck checked. And the nerves of the neck that come out of the neck actually give function and life to your arm and your wrist. So if we free up those nerves of the neck, oftentimes the carpal tunnel subsides and gets better, and the body heals itself again.
Yeah, and I just want to quickly go back to that gentleman's question about stroke. I mean, what was the people that came in, what was their condition before they came in? You know what I mean? Like that plays a huge role in the type of treatment and the effect of a treatment on someone if they're coming in
already.
And that
there's
case
so many
that
factors
that
too.
case that he talked about was 2 weeks after.
We're gonna come back.
Okay.
We're gonna take a quick break and we'll be back. Hopefully we'll have more questions and more answers for you. Stay tuned on Health Matters.
The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome back to Health Matters. We're looking at alternative methods for pain relief, and right now I'm talking with the chiropractic ladies. We're just going to finish up Kathy's question about carpal tunnel syndrome. So, Dr. Kimberly, how are you going to answer that question?
So in addition to what Dr. Nancy said about checking the neck and the nervous system, you can also do some work on the muscles through the forearm. Kinesio taping is fantastic in that with kinesio taping you can actually get full range of motion in the joints, where old sports tape you would basically immobilize the joint. Depending on how you apply the kinesio tape, you can actually get it to relax muscles that are overactive, which is often the case with carpal tunnel syndrome. So I'm just going to get you to bend your wrist and twist out a little for me.
So what's the difference between this tape and just regular tape, like duct tape?
So
people put on their
tape,
hockey sticks.
Yeah, so kinesio tape has a bit of a stretch to it.
I can see that, yeah.
So depending on how we apply it, you can, as I said, you can apply it in a certain manner that will relax the muscle. You can apply it in a certain manner that will actually activate weak muscles. You can also apply it to help with lymphatic drainage and to help with general swelling.
And how long does a person wear this? And does it come in different colors? Because if you're going to the office, I mean, it's got to be fashionable.
It does. It does come in different shades. Color means nothing. They all do the same thing. Generally, people can wear it, depending on skin type, anywhere from 1 to 5 days. Most people, you can wear it in the shower, you can wear it swimming, doing your regular physical activities. Nancy has full range of motion. It's not restricting any motion whatsoever in the wrist or forearm.
So is it going to rehabilitate the arm as well, or no? Or just prevent it from degenerating further?
It does a little bit of both,
okay,
depending on how it's applied. So you can basically do your normal activities without the increased risk of increasing injury. I'm big into sports and fitness, and if I have an injury, I still want to get out and do the stuff that I do every day. Kinesio taping is a great method that will allow you to continue with your normal physical activities.
So does somebody have to go to a chiropractor to get Kinesio tape, or can they go to their local pharmacy and get the tape?
You can go to your local pharmacy and buy the tape. It's the manner in which it's applied that gives the therapeutic benefits.
Sure, and you're under a doctor's care, right?
Yes.
Yeah.
Yeah, and I've taken courses in how to apply the Kinesio tape.
Okay, wonderful. So hopefully that's answered Kathy's question. Thank you for that, for bringing your tape.
No
do you carry your tape wherever you go?
Nowadays, yes, I actually do.
Just like Stephanie carries her needles wherever she goes. Okay, I think we have another caller, if I'm not mistaken. Amir. Hi, Amir. How are you? How can we be of service to you?
Very good. Hi, good evening.
Good evening.
My question is actually last year I had a little tense in my neck, actually, right shoulder. I went to chiropractic and he did something like relax my neck, and he twisted my neck actually, and there was some cracking sound actually. I just want to learn what exactly that was. Was that sound from the bones, the tissues, or muscle?
That's a great question. That's a great question. I was actually going to ask that question. What is that sound, that popping sound?
So that sound is actually gas escaping from the joint.
Okay.
When we increase the volume in the joint, we also increase the pressure, which causes the gas to escape. So I don't know if you've ever cracked your knuckles, you'll find that you can't do it again for approximately 20 minutes. That's about how long it takes the body to reabsorb the gas. So the bones aren't cracking, the tissues aren't doing anything, it's just the gas escaping from the joint. That's what causes the pop.
I often tell people that as you're opening, it's the same as like when you're opening up a pop can, that pressure gets released. It's the same sort of thing. There's no bones cracking, or it's just pressure being released off of the nervous system and the joint. Yeah.
Yeah, okay.
Okay.
Are you okay with that?
Yeah, thanks very much.
We satisfied you? Another happy customer?
Yeah, thank you very much.
All right.
Thank
you. Have a great
you.
night. Okay. I have a question, another one. Okay, I met a gentleman, his name is Dr. Eric Pearl. He's a chiropractic from Los Angeles. I met him years ago here at the Energy Psychology Conference, downtown Toronto. He wrote a book called The Reconnection. So he had a very lucrative practice in Los Angeles, 3 homes, Mercedes, all the toys. I mean, he did really well financially being a chiropractor. What happened to him was that one day, basically, it wasn't really one day, it was a journey. When he was working on someone, his hands got really hot, and he felt energy moving through his hands. And before he knew it, he was actually performing miraculous healings on people. People could now walk, people could see, people were being cured of chronic diseases such as cancer. He's trained over 75,000 people in this reconnection work. His book is sold all over the world, and he's recognized by major top doctors in United States. So my question is the evolution of chiropractic moving into more of an energy field, more away from the manual adjustment, or is it both? And I ask that also because, I mean, I've had treatments from Dr. Nancy, a chiropractic treatment, and when you're touching my body, your hands get very hot, and there's a lot of energy running through you, and it's very, very nurturing and very warm and very healing. Maybe not to the extent as Dr. Pearl, because he's really connected to something. But I think we need to acknowledge that something else, this innate intelligence is working through chiropractors.
Absolutely, and to expand on that a little bit, and that's a lot of what BJ's work was. He always said it's I mean, you can go to school to be the chiropractor and learn the physical ability to adjust somebody, but it's that extra something that you bring to the table, because there's an energy transference that we, whenever there's a healing, I don't know about Dr. Pearl's healing, but whenever there's a healing, there's obviously an energy transfer between human and human.
So transfer, I mean, let's talk about the idea of transference. Do you ever experience transference in terms of taking on other people's symptoms? I mean, I've experienced that when I first started out in the field. When people had asthma and I touched them, I'd be like, my chest would contract. And for me, I had to learn over the years to set my boundaries as a health professional, because I would take on people's stuff.
Yeah.
So, and it's not fun. And I think people out there need to know that for us being, working in the field, I mean, it's dangerous for us in that sense because we're picking up a lot of people's energies that are sick energies, and we need to cleanse ourselves of that. So do you find that as well?
I find, I don't know about you, Dr. Kim, but I find that you definitely have to ground yourself and allow your innate intelligence to work through you, because it's not you doing the healing. Again, you're the facilitator. So you have to kind of ground yourself and take yourself out of the picture and allow that power to work through you and tell you where you need to adjust or heal, or wherever you need to bring that energy to that person that is being healed or treated.
Sure. Okay, let's talk about tips. Dr. Kimberly, you have some tips for people.
Yes. So things that people can do outside of the office to help maintain their health and wellness. One of the major things we see in just about everybody out there is we sit at desks all day long. We sit in cars. We sit in front of the TV. Everybody gets a little sore and achy. So one simple stretch that you can do if you've been sitting at the desk all day long, our glutes take quite the beating. Don't do this one if you have a knee injury, but if your knees are fine, what you want to do is you want to take your one ankle, cross the ankle over the knee, sitting up nice and straight, turn slightly towards the ankle that's crossed over, keep the back straight, and just lean forward.
That's a great stretch.
You should be able to feel a really nice stretch in the glute region. Something you can do easily at the desk. You want to always do both sides. You want to hold the stretch for about 20 seconds. Another thing that I commonly recommend for patients to help realign posture, because we do get this anterior head carriage, are chin tucks. You may not want to do these at the office because basically you're giving yourself a beautiful double chin, but the premise behind it is sitting up nice and straight. You just pull that chin straight back. You hold that for 3 to 5 seconds, relax, let it go. Do about 10 of those a day.
I usually tell people, like, people spend so many hours in a car and commuting to work or
their
wherever.
lumbar area is just
absolutely.
Taking a beating sitting in the car.
That's right. I usually tell them to practice that head forward posture move in the car when they're driving.
What about sleeping? Are there certain pillows or a certain posture when we're sleeping?
One of the biggest things that we want when we're lying in bed, when you get into bed tonight, is just check and see head, neck, trunk, is it aligned? Do you have too many pillows? Is it pushing your head forward if you're sleeping on your back, or if you sleep on your side, is it pushing your head up? You want everything to be nice and straight and aligned, and you want some support for the neck. Stomach sleeping, big no-no. No. Yeah, don't do. Basically, you're lying on your stomach, your head turned all night long.
Ouch.
That really does a number on the joints in the neck there. So side or back, and just proper support, not too many pillows, not too few.
What's your model in terms of providing health care? I mean, I know people come to see you for pain relief when they're in the midst of pain, but also, do you also have like a prevention program? Is chiropractic set up for prevention or wellness?
Yeah, basically our goal is to empower people to get healthy and stay healthy for a lifetime by being proactive with their health and taking responsibility for their own health. And it's really a means of educating them to make better lifestyle choices to prevent them from the injuries from reoccurring. So
lifestyle choices, like what? Like sleep?
Like promoting health. It includes better diet, watching what we eat. If we're eating garbage and if we're eating fast food, we live in a very busy time right now.
Sure, and what does that do to our spine?
So it chemically stresses our spine, and it creates these interferences within our spine, and it makes for, decreased health. It makes us downward spiral. So eating really great food and good nutrition, keeping well hydrated is really, really important. We're 75% water, so we need to constantly be replenishing our system. So doing those kind of things, exercise, moving our bodies, stretching. We are meant to move. We are not meant to lead a sedentary lifestyle. So we're not meant to eat preservatives that, are in all our foods, and they're chemically treated. So our bodies are actually, research has shown that our bodies aren't decomposing at the rate they used to because of all the foods and the preservatives in our foods that we're eating. It's preserving our bodies. So all of this adds chemical, physical, and emotional stress to us that interferes with our body's ability to heal itself.
Wow, there's so much. What are some last minute, tips or advice you'd tell people to take care of their spines?
Go see your local chiropractor. you
Get your spine checked just like you do your blood pressure or cholesterol, because you don't know when you're misaligned or when things are interfered with. Pregnancy is one of the best times actually to get introduced chiropractic if you haven't before, because it just helps everything, you know, remain balanced, and allows for there's 4 ligaments that basically suspend your uterus, which is a muscle, and it helps with an easier delivery and a shorter delivery. So I mean,
chiropractic helps with everything.
It really does.
It's amazing. All right, ladies. Thank you so much for being here. I really appreciate your time.
For having us.
And we're going to take a quick break. When we come back, I'm going to speak with a lovely massage therapist. Please stay tuned. Thank you.
The opinions expressed in the following program are those of the participants and do not necessarily reflect those of Rogers or Rogers TV.
Welcome back to Health Matters. We are looking at alternative methods for pain relief if you're just joining us. And with me in studio now is a lovely massage therapist, Lee Sue Hackett. Hi, Lee.
Hi, thank you for having me.
Thanks for being here. So you've been practicing massage for how long?
The last 7 years now.
Wow. And you're in Brampton?
I'm in Brampton.
You're in Brampton, okay. So touch is very important to well-being. Why?
I came across a research article from Ben Benjamin, PhD, and the study revealed that over 100 years ago, about 99% of the babies actually died in orphanages before the age of 7 months due to a condition called marasmus. Now, what that is was they died due to a lack, it was a deprivation due to touch. So now what they found was they were, the ones that were held and fed during what they were held, everybody were given the same amount of foods, although the ones that were touched and nurtured actually survived, grew faster, the weight put on much quicker as well, and they were released from the hospital much quicker than their counterparts that were untouched.
Yeah, I think either that study or one like it was in the psychology textbook.
That's
I studied at York University years ago, so touch is very important. What's an assessment like for you? Like when someone comes to see you, what do you do?
So the assessment actually starts from the moment you greet them. You're looking at their posture assessment. You're also assessing their gait, the way they walk, okay? When you bring them into the room, you're also going to be looking at different imbalances in the body itself. You're going to ask some questions. Orthopedic testing, ranges of motion testing will also be enveloped in the treatment as well, so that therefore you can facilitate the proper treatment for them.
Sure. And what's the system you work with? The muscular system? We're going to post, is that correct? We'll post a photo of the muscular system so viewers at home can get an idea of what system the massage therapist works with.
Yeah, so generally we work with the muscular system of the soft tissues, and the muscles itself weigh so much. It comprises of over 650 muscles, okay, synergistically all working together. Now, that incorporates more than half of the human weight pretty much. So now when we're working with that, you're looking at different, the human muscles itself is cardiac, there's skeletal, and there's smooth muscles. So all of them do different parts for the body itself.
Let's go back to assessments. How important are assessments in massage therapy?
Very important.
Why?
So each time you meet someone, it's definitely important to assess them prior to the treatment itself.
Do you have any stories to share?
Absolutely. Okay. I've got 2 great ones. So the one gentleman that had come into our clinic presenting with calf pains in both his legs. So he was actually trying to rush me through the assessment so he can get to his golf game within the next hour. So after doing the orthopedic testing, it revealed that there may possibly be a deep vein thrombosis going on in the calves, which is a blood clot in the lower limbs. So I was a little concerned. I explained to him that he was not going to be receiving treatment that day. I referred him to our medical doctor in the clinic, and I later got a letter from him thanking me, stating that indeed he did have the blood clots in the legs.
Wow. So if you didn't assess him and send him to the doctor, what would have happened?
So
you
if we had
massaged him?
That's right. So if we had continued to do the treatment on him, we could have very well released the clot, causing an embolism, going up to the lung or the heart itself, causing stroke and other probably more disastrous conditions.
Wow. So assessment's huge in massage
Absolutely. Therapy. With the second case, I had a woman that was a pedestrian struck by a passenger vehicle.
Yeah.
So that case in itself, she was, after going through reconstructive surgery rather, soft tissues, joints, and so forth. Now with this type of assessment, it would be a lot more difficult due to the parameters of the injuries, right? Yeah. So now, not only am I looking at the notes from the medical doctors, surgeons, other rehab specialists working in the team itself, now I need to take that, put it together, create a treatment plan that will be specific to her now for that time.
Okay. What type of significant changes can massage therapy induce in a person?
Okay, I've got a great story for you there as well. I had a truck driver that came in to see us into the clinic, and he presented with both his arms were flexed without being able to extend. So after the assessment itself, I noticed it was most likely due to muscular from the occupation itself, right? So we designed a treatment plan of about 3 to 6 treatments. Following the third treatment, he came back sharing that he was finally able to eat without the aid of his wife or even bringing his mouth to his hands, feeding himself. So he was quite relieved with the treatments. So that made me feel really good.
Yeah, that's got to be rewarding. Wow. Do you have any other stories?
I can't think of one right off the head. There's many, many great stories.
Okay, here's $1 million question for you. When somebody sprains their ankle, do they use heat or cold, and why?
Okay, so in terms of an injury that is acute, we always want to apply ice on the injury itself if there's swelling. If they're coming in for treatment, again, we go back to the assessments itself. We generally want to make sure that it's not broken. There's no other bruising or swelling in the area, because we're not going to want to work on the actual soft tissue damage at that time. We would refer them to a medical practitioner to assess it first. Now, in terms of ice or heat, generally we follow the rule of rest, R-E-S-T. So rest, we want to elevate the area. Then we're going to I forgot what S meant.
It's okay.
Sorry, it's not rest, it's rice.
It's
I'm
rice.
sorry, rice.
Yeah.
We want to rest it, we want to ice it, we want to compress it, and then we're going to elevate the joint itself. I'm sorry about that.
It's okay. What type of tips do you have for home viewers in terms of posture, you know, circulation? Carpal tunnel?
Yeah, carpal tunnel, which you guys spoke about earlier as well. Some great stretches we can definitely do when we're sitting in the office, because we're always typing. Absolutely, very simple stretches that we can do. Just bringing your arm out extended, okay, and you're just going to bring the other hand. Ideally, if you can get a 90-degree angle, not everybody can do that without the pain. If you want to facilitate the stretch a little bit further, I like to extend my hand out this way, pointing it away from me. Okay, so that one is actually going to compress the carpal tunnel area. If you want to stretch the area, we're going to bring the arm out this way, and then we can bring it in towards you. Okay, so very, very simple stretches. Also neck ones, we also have neck tension, creating headaches sometimes. So just by bringing, I like doing the ear to shoulder, but a lot of people tend to cheat when they bring their head to the side, they tend to do this. So in order to facilitate not doing that, you sit on your hand and then bring your ear over to the shoulder. And if you wanted to facilitate the stretch a little bit further, you're going to add some over pressure on the head there. Okay, so you would want to do that on both sides. I like to hold my stretches for about 30 seconds to a minute just to facilitate the stretch a little bit further.
Yeah, what about self-massage? I mean, should I be like rubbing myself?
Absolutely, so I can do a demonstration on you.
Yeah, I love massage
everybody
therapy.
loves massages. So just by applying pressure on the area that is painful would actually release the pain itself. So you want to do some kneading motions, just circular motions to help the blood flow facilitate, and you always want to work towards the heart, depending on what you're trying to work on. If we're trying to increase the circulation, definitely centripetally towards the heart, allowing the flow to go throughout the body and circulate.
How often should people get a massage? I mean, if I could, I'd get one, twice a day.
Of course. So again, it depends on the individual, what
Sure.
they're coming in for. Generally, if it's just for relaxation, stress reduction, once every 3 weeks to once a month is fine. Acute conditions, depending again, if you've got sciatic nerve injuries and so forth, I'd probably like to see you initially for the first 3 times for the first week, and then we would reassess again at that time.
And what are the effects of massage? I mean, when I walk away, I have a general sense of well-being.
Absolutely, general sense of well-being, relaxation. You feel calmer, a sense of peace as well. Your body's relaxed, your mind's relaxed. The person leaves your clinic feeling wonderful.
Something that I read a couple of weeks ago, I'm going to veer away from pain for a moment.
Okay.
In Hollywood, they're doing diamond massages.
Right.
I don't know if you've heard of this, but they're taking real diamonds, 1.5 carat diamonds, and making powdering it so it's small, and they're putting it on people's back with iron and using that as a form of massage therapy. Apparently, it helps with detoxing the body from the electromagnetic radiation from computers, microwaves and stuff like that. And have you heard of that?
I've read a little bit on that, so it's really interesting. I don't know the dynamics or the scientific research that backs up that study itself. That's really interesting. Now it seems like we can veer away from the regular lotions and potions on the person, and we can definitely use other ways to facilitate the massage now. So that's
I wonder how much that one costs.
Oh, that's the $1 million question.
That is a $1 million question. Okay, I'm going to come to you. I'll bring my diamonds. We can.
Yes.
We'll find diamonds somewhere.
We'll smear it all over your back.
We'll have to test that one.
Sounds great.
There's other types of massages, though. For example, like Lomi Lomi, the Hawaiian massage.
Yes, there's Lomi Lomi. Then there's Tuina, right? That's another branch of acupuncture as well, under TCM. Then there's the sports therapeutic massage, meant to enhance the sports treatments itself. Then we got the regular relaxation, just the general sweetest massage with just the basic 5 strokes and so forth, again towards the heart and so forth. Many different treatment types out there.
And do you use like hot stones or various oils?
In my specific clinic, we don't use hot stones, but I do use other modalities.
Oh, like what?
I do use acupuncture as well, and then there's also different types of lotions.
Oh, that's nice. So you combine acupuncture with massage.
Absolutely.
Wow, that's going to be effective.
Again for pain relief, to enhance that feeling, to make it last a little bit longer.
Do you do the massage first, then the acupuncture, or how does that work?
It depends on the condition. So now when most people come in with the fear of needles or just fear of being touched when the area is so painful, you want to calm them down, do some deep diaphragmatic breathing techniques with them. You can go in and do a little bit of static touch and help facilitate the relaxation, and then you can go in and with the needles, and then you can come back and do the massage as well and spread the energy throughout.
Do you notice that when people come to see you, like oftentimes they're in pain, but then sometimes when people come to see you and you touch them, they suddenly feel pain, like they didn't realize the pain was there until you touch them. I mean, I do that to my friends all the time. I'll ask to hold their arm and I'll press them and they'll be like, ouch, and I'm like, well, see, you didn't know how much pain you're in.
That's right. So oftentimes we're not aware unless you're really connected with your body.
Exactly. And so when we're disconnected from our body, we're not realizing really how much pain we're in until someone, I mean, I'm lightly pressing, like this on a person, and it's intense for them.
And you may very well be actually activating a trigger point, specific points on the body, especially when women, we always get shoulder tension. So now when you're going in and pressing these specific spots, you're like, ouch, that really hurts. And you didn't realize it was there because we're so used to that tension to be there. So this way, by helping massaging it, we're actually releasing the endorphins and so forth, and the feel-good hormones.
Yeah. Now, do you get massages?
I often do. Very important, yes. At least once a week.
At least once a week?
At least once a week.
Nice.
Yeah, just for general well-being, and most of the times I do have issues as well, like we all do.
That's nice. And what do you like about massage therapy?
Oh, it's fantastic. I get to meet so many different people. You're educating the public as well in regards to treatments. So it's really rewarding. I love it.
Lee, thank you so much for being here and educating us about massage therapy, and continue to rub everybody and make them feel good.
Thank you so much, Dr.
And thank
Lana.
you, home viewers, for tuning in to Health Matters. I hope today I've given you additional treatments for your health care. And I'm just going to leave you with the words by Gandhi, who said, health is the real wealth. Take care of yourself.